and welcome to the Chaplain's Compass with John Betz and
Alyssa Tremaine, and we are glad to have you back and to have a great conversation today about pivoting in chaplaincy with our special guest, Alyssa Foll. Alyssa is the Director of Ministry Formation at Ascension Health. She's based out of Chicago, Illinois, and we're so glad you're here, Alyssa. Welcome.
Thank you. Thank you for having me. I'm really excited for our conversation.
I am too. And as always, we always like to start just by asking our guests, how did you find chaplaincy? What was your journey into chaplaincy to begin with?
I feel like for as many chaplains as you ask that question to, you're going to get as many answers, which I love asking that question. So I grew up around healthcare. My dad in his career was a healthcare administrator, and so hospital administrator. And so I sort of grew up knowing things about hospitals and healthcare and spent my summers volunteering. And I really thought that I wanted to be a clinician. I thought I'm either going to become a nurse and then go on to advanced practice, or I'm going to be a physician. And I had high school chemistry and thought, this is the most terrible thing I've ever experienced. um, but what also was happening at the same time was really recognizing, as much as I did care about science, about healthcare, about interest in being a clinician, I realized my true passion was ministry. I was very involved in youth ministry in my church and prayer ministry. And so I didn't even have a vision at that time of what healthcare chaplaincy was or what that could look like, but I just knew, hey, I feel called to go to school and to study theology and to pursue some type of ministry. So it wasn't until I was in graduate school that a friend said to me, hey, you mentioned, growing up, you always thought you were going to be a clinician. You thought you were going to be in healthcare. Have you ever taken a unit of clinical pastoral education? No, I haven't. That'd be a great thing to do. And after one unit of CPE, I was completely hooked and realized, hey, this is the path I want to go down. Um, there's just really nothing quite like what I call doing theology at the bedside, right? Like, I love to read, I love to study. Grad school was a great time for me, but there's something about when you're sitting with someone who's saying, is God punishing me for actions that I committed earlier in my life? Or I really feel that my vocation in life, my purpose in life is to be a mother. And now that's not going to be possible biologically, right? Or how do I find meaning and make meaning in life in the midst of this chronic and debilitating illness, right? Like all of these different things. But to do that at the bedside with someone in conversation just brought theology and life and chaplaincy into full focus. So that was kind of my start, and then ended up, of course, completing additional units of clinical pastoral education, and went on to become a staff chaplain for about 7 years. It was a winding road, but I got there, and yeah, absolutely have loved my path as a chaplain.
well, it sounds like your desire to study documents and studying theology and study books then became translated into what Anton Boysen talked about in studying the living human document.
Not to sound like a total stalker, but I saw a video of you, Alyssa, where you were talking about doing theology at the bedside, and you said something in the video. You said, now the patients are my sacred texts. And I thought that was so beautiful. I actually borrowed that line at a recent sermon, because it was all like the theme was about the Bible. And that's exactly what you're talking about, John, is the theology comes alive in humanity. I mean, that's what it's all about. But how long ago was that when you first did your CPE internship?
Yeah, my first unit of CPE was 2012. So it's been a hot minute. and then started working full time as a chaplain in later summer, early fall 2013. It's seen a lot in that time.
Yeah, and you started out pretty young, right out of seminary, which is now becoming more of a norm than it used to be. And that's kind of what prompted us to think about this episode of the podcast, because you started out in bedside chaplaincy, fresh out of seminary, and now you're in a very different position. You're leading ministry formation, which is in itself a little bit different. But we're curious about that shift for you. What prompted it? And was it something that you discerned over time, or how did that come about?
Absolutely. Well, and I appreciated, Alyssa and John, like when we were talking about what this episode might look like, I was reflecting on how many of my colleagues came into chaplaincy as a second career or a third career, right? Um, and so it at the time when I was kind of going through it was a bit rare to meet people who were right out of graduate school or right out of seminary who were pursuing chaplaincy. So I feel like if you come into chaplaincy as your first career, if you will, um, you just naturally do kind of reach a point of wanting to explore different options, right? So many different things could bring you to that point. It could be burnout. It could be that you have other gifts and talents that you want to bring to bear in some way. It could be um, family needs and looking at, hey, I need to grow in compensation in such a way to be able to provide for my family. Like there's so many different things that might bring you to a point of saying, hmm, like, is there something beyond bedside chaplaincy, clinical chaplaincy? And so for me, that was like it was like a very slow process, gradual process. But I realized how much I did love teaching, facilitation, education, but I equally loved chaplaincy. And so for me, it kind of began to click in my mind, oh, the most natural path would be to become a CPE educator. Like, that's the path I should go down. I should become a CPE supervisor. So in late 2019, I started getting my packet of materials together, my applications, and you have to record a video of yourself teaching, and like started getting all of these materials together. I'd identified 4 different health systems, like academic medical centers that had openings for CPE educator candidate, and sent all of that off in early 2020. And then I bet you can guess what happened next. uh, so, January, February, I was supposed to have interviews, March, April, May, right? And we come into this global pandemic. And so some of those positions were frozen at the start of COVID, just because things were so uncertain. I was accepted to a couple, but it didn't work out for, again, being in the middle of the pandemic. So that sort of delay just got me thinking a lot and praying a lot, discerning a lot. Um, and I really felt very clearly at that time, like God was kind of impressing on me, hey, your heart for teaching, facilitation, education, formation, that's exactly it. But I'm not calling you to form chaplains. I'm asking you to form leaders. I'm like, that's great. God, do you want to say any more about like how and when and where and what's that going to be? But before I came to ministry formation, what was really sticking in my mind, as much as I wanted to be a CPE educator, I kept thinking, where is there CPE for hospital administrators? Where is there CPE for healthcare leaders, right? Because I realized I could have the most wonderful CPE education program, be a part of that. I could, truly pursue this career and be excellent at forming chaplains. Um, but all it takes is one hospital administrator who truly doesn't understand the value of spiritual care, uh, sitting down, looking at a spreadsheet and saying, we're gonna cut the department in half, or times are tough. We're gonna go ahead and sunset our CPE education program, right? So I had this thought, like, how do I take these incredible experiences that I've had in clinical pastoral education and truly the action, reflection, action method? Like, how do I take that to leaders? That was kind of my question. And so in this waiting period, did a lot of research, a lot of Googling, a lot of praying. And on LinkedIn, um, I connected with someone who's now our vice president of vocation at Ascension, and reached out to her and said, "Can I have an informational interview? Like, I think I understand what formation is, but can you tell me more about this?" And ended up having a conversation to learn more just about kind of the context of ministry formation within Catholic healthcare, but then specifically what that looks like at Ascension. And I remember getting off the call thinking, this is it. This is the next thing. Um, and so it's kind of a funny story how that all came to be in the fall of 2020. But I really, I really do feel like I found that sort of CPE for leaders, so to speak, in ministry formation. And so, yeah, it's been a long winding road, but I've been enjoying the unfolding journey.
I came from a tradition that formation really wasn't emphasized. It was a lot of uh, there's a lot of education, and so education was almost equated with formation. And so you have a lot of people who were highly educated, but as my sister's boss would say, Alistair Begg would say, a lot of people were educated beyond their intelligence. Uh, and I would say educated beyond their emotional intelligence. So what is formation? Like what separates that from education?
I think of formation as all the sort of experiences of your life that have shaped you into who you are, right? So I am who I am because I grew up in Chicago, but I also grew up all around the country, actually. And so I've been shaped, I've been formed by that. So we're all being formed by where you grew up, your family, um, culture, religion, all of these things, right? And so, but what ministry formation is a way of saying, let me be intentional about the things that are shaping me. And so, for instance, in Catholic healthcare, that's let's spend intentional time reflecting on our mission, vision statements, values, Catholic social teaching. Like, let's have experiences that include education in many times, but also have experiences that allow people through spiritual practices or reflective practices um, to truly begin to be sort of steeped in this and formed by this way of thinking, acting, making decisions, um, and sort of having this. We don't usually use the word worldview, but kind of this way of looking at the world um, that's in alignment with, in my instance, Catholic healthcare. And so, yeah, I think that's just the bottom line. Like, we're all being formed every single day by what we read, by who we're with, what we're listening to, all of that. We're constantly being formed. So, ministry formation is just that very intentional um, time that's spent and really immersing yourself in, if you will, sacred texts of, again, mission, values, um, Catholic social thought, theology, and then reflective practice.
that reminds me of the Eastern Orthodox theologian Callistus Ware talked about how if you're doing the liturgy, the work of the people, and you're repeating things over and over and over and over and over and over, that's you are being formed by those texts, and uh, that's and like what you're saying, it's that we are being formed by what we're doing, what we're seeing, and how we either proactively or just by default how we're uh, spending our time. Out of curiosity, for chaplains who feel a pull beyond like traditional roles, what's the difference between, or how do you distinguish between a genuine call to, as uh, Ross from Friends would say, pivot, pivot, and and then and burnout?
I think I kind of look at all of it holistically as opposed to an either or, right? Like, oh, here's burnout or here's like a genuine pivot. Um, because it may be that burnout is the circumstance in your life that brings you to ask those questions to say, is there something more? What's been missing? What do I feel drawn towards? Or what, conversely, what do I, what am I trying to run from in this moment? And that doesn't necessarily mean if you're burned out, you have to pivot. Um, I can think of times in my career where I experienced burnout, but like you find ways to be renewed even in the work. Um, but I believe there also are times where burnout is really sort of that catalyst that brings you to, I'm in need of a pivot. Um, so again, could be more, hey, I'm feeling called in these new ways, or I'm sensing um, something that's exciting and inviting and calling me forward. Or it could also be, hey, I can't keep doing this anymore. Um, I'm burning out, but it brings you to those same set of questions and same sort of reflective work to say, okay, then what is it that I'm being called to in this season?
There's a lot of new chaplaincy tracks that are started in seminaries, which is great because I think a lot of chaplains have found that seminary has not necessarily prepared them to be healthcare chaplains or chaplains in other contexts. Um, and then even going further, sometimes when chaplains find themselves in leadership positions, like managing a department, managing a budget, they've had to develop some business skills, some other skills that they didn't learn in seminary. And now we're going into uh, further even thinking about what about some non-traditional roles where you're not providing care bedside. So I'm curious about your experience, Alyssa. What skills do you feel like that you've learned in seminary or as a healthcare chaplain were actually really helpful for you in this new position? And what skills did you actually have to develop or evolve or adapt in this new this new role that you have now?
So I think one of the things that you certainly could learn in college and in seminary, but hopefully you especially learn in CPE, which is learning how you learn. And can you continue to learn? Can you continue to, we would use the language, self supervise, um, even outside the structure of a program or a classroom or something like that? So I think if you have a disposition towards, I'm always trying to continue learning or to, go into or to study a different topic or discipline that isn't normally something that I've studied before or hadn't really caught my attention in the past. But if you're like constantly kind of continuing to learn and grow, I think that's a skill that has served me very, very well. And I put it kind of simply in following your curiosity and the things that are calling to you or that you're wondering about. Um, so that's one thing for sure. I think the other skills, certainly in my transition, would be really deep listening skills. And that's not a surprise as a chaplain to bring that. But it's both listening very, very carefully and attending, but also what I would call translating. And what I mean by that is I was on a meeting not too long ago with um, a bunch of folks who are highly specialized in technology. And so we were having a conversation about a technology project. And a lot of what was being discussed, I felt like other people were sort of talking past each other. And so it was through that really deep listening and then sort of being able to translate to say, okay, I don't have the technical expertise that you do, but if I'm understanding you correctly, it sounds like this. Does that match with what this team is saying and their expectations and how they're approaching? And so, sort of bringing different groups of people together to creatively problem solve, or again, something as simple as not talking past each other in the work. Those are skills that go such a long ways in any pivot, in any sort of next step in a career. Um, so those are just a few things off the top of my head. Um, but yeah, listening and translating, like being able to jump into something unfamiliar and work your way through because you're listening deeply and you're asking questions and you're checking for assumptions, like that'll carry you through so many new experiences.
And those are things that you can't really use AI for, like that you can't just like pass on to art. Those are things that are really still needed. Yeah.
Absolutely. The nuance, the inflections, just even like you can see even in a virtual space, you can see someone with like a micro hesitation. Those are things that AI is not catching. And so that's a human skill that you bring and need. Oh, I did think of another skill. If you want me to talk more about skills, I'm like, I know I had more than listening and translating. So I would say one additional skill that has served me very well is being able to triage. So this is something as chaplains we do all the time. How do you manage competing demands? Um, and that is a huge skill of leadership, and in any kind of fast-paced industry, whether you remain in healthcare or you go outside of that, you will find how do you know what's the thing that you should pursue first or spend that level of time on, or um, if you have competing stakeholders who all want your attention, how do you navigate that relationally? So anytime you've ever received, 3 or 4 pages in a row, and have been like, oh, okay, how am I going to triage this? You will use that in leadership as well.
It's almost become a joke because we at my hospital system, because it is such an important skill to teach our chaplains, our managers, our directors, and me. It's a skill that I have to utilize all the time because I have to be able to delegate certain things to certain people. So it's a joke because we're like, yeah, we should have a class on triaging. Um, and it's almost like, well, that's kind of like a class on general leadership and delegation. Going with your the core chaplain skills, uh, nunchuck skills, other. Sorry, I'm a bit cheeky with the quotes today. How has your theological training shaped the way that you approach the organizational leadership and formation?
So again, part of my winding path of my career thus far is I studied theology in college, which was a very robust program. In many ways, it was almost like a mini MDiv because I studied theology, but I also had a minor in biblical languages and in pastoral theology. So when I went to do my master's, I decided, hey, I think I'd like to specialize even a little bit more. And so ended up getting an MA in systematic theology. So studying that so closely, it's going to sound really, really kind of silly, but like learning at how to look at things systematically through systems theory, how things fit together, how systems operate, how do you make something cohesive? Like, some of those things that you learn in systematic theology absolutely apply to actual systems in healthcare, and just the world at large. So that is certainly a piece that I keep with me. Um, and then I think the other thing too was, even though I was pursuing this degree in systematic theology, we were allowed to audit classes as well. Like, you could have up to one free audit per semester. And so, interestingly, all the classes I audited were in the leadership and spiritual formation track. So, like, here I was, history of pastoral care classes, right? Or um, education and formation. I think it was called teaching for transformation. Like, so those are some of the things that I still think back to and refer to from my graduate school education that is still with me now.
Yeah. But I love that because it's like little blueprints, little clues along the way that you were interested in this all along. Like this has been developing over time. Um, you don't really know where all these branches of interest and paths are going to take you. Sometimes the roles aren't even created yet. Um, and then you find that. So, one question that I think I've struggled with myself, but also with chaplain colleagues that I know who have pursued different paths in and outside of chaplaincy. Like, for instance, somebody who is pursuing becoming the director of a palliative care unit, or working in an organ procurement organization, or now doing being in an ethics role, becoming an ethicist, is the question, am I still a chaplain? Like, what's my pastoral identity? How does being a chaplain fit into this? Or even, like, do I keep reverend in my title, or like in my business card, in my signature? Like, how does that come together? So I'm curious about how that's been for you and how your identity has evolved over time.
Again, in the circles that I'm in, and my colleagues and friends that I'm talking to, we're asking those same questions of ourselves and of our experiences. So I think for me, I have had to evolve a bit in what I truly, truly believe is ministry, right? So, again, if you had caught me straight out of graduate school, working as a chaplain in my first role, I would have been like, no, I believe in the priesthood of all believers. I believe in the fact that, like, all people can truly minister. Obviously, I have this specialized education and training that, allows me to work in this role, but, like, truly all work can be done as ministry. Well, it's kind of like, well, Lissa, you say you believe that. Do you actually believe that when maybe your day is mostly sitting at a desk responding to emails or proofing a slide deck to get ready for a facilitation or a formation retreat? Do you still believe that's ministry? Or if you step outside, to your point, Lucy, like, advanced care planning, organ procurement, is that ministry? Is there something essential about the way that you're going about that work, um, that can be seen and done as ministry? And again, I don't say this to be glib, because I would have been able to tell you from my own theology what I thought and what I believed. And then it's another thing to truly live that as part of your identity. Um, I will say though, like, it's funny, in the role that I have now, I don't always get to mention that um, I'm a chaplain by background. Like, sometimes it's I'm just talking about the work that I'm doing or my current role. But it is interesting because I do try to bring that up often at some point to say, hey, I know I'm working at this, like, system level of leadership now, but I actually do know what it's like day to day in a hospital, in an acute care facility. I do know what it's like to work in an outpatient oncology center, like, um, and so to be able to use that to relate with other folks and connect about, day-to-day operations or experiences, or even people will say, "Oh, like, thank you. You're such a good listener." And I'll be like, "Did you know I started my career as a as a chaplain?" Like, just kind of being cheeky a little bit, but like finding finding ways to say, "Hey, this is still a part of my life." Like, it's not as though I've chopped that off or it's completely separate. Like, being a chaplain still very much informs my practice of leadership, how I engage with other people, and certainly the skills that I bring to the role that I have currently. Leasing to your point about identity, I think one other thing I try to hold on to is about vocation, and that vocation is meant to grow and evolve, because part of what it means to be human is to learn, to grow, to make mistakes, to come back home to yourself, to try a new path. And so to remind myself, even though, yes, my identity might be shifting, it's also because my vocation is growing and expanding and transforming. And that is at the heart of what it means to be human. And so, even though it is still scary and unsettling, um, that is something that has brought me a lot of peace, as I have kind of stepped outside of more traditional healthcare chaplaincy.
I love that imagery of transformation. And that is so much about formation that you work in right now.
As people start seeing you as an administrator or see you as someone who is outside the traditional forms of ministry, I can certainly imagine people going, "Oh, I didn't realize you're you're ordained." Or it is very funny. I run into people all the time where they said, "Oh, did you know that I'm also a pastor on the side?" And I go, "Oh, okay. Tell me more about that." And we had one person over in Augusta who I had originally thought that he was a chaplain uh, by his job description because he was listed as part of that group, but he had actually changed and had become part of the diversity, equity, and inclusion and belonging group, and was very active in that. Uh, and I was like, oh, what? And we actually have another person in our DEIB group at Wellstar who has their degree in theology, and so being able to connect with them about that has been very rewarding. But being able to see that not just me saying, "Oh, what can I do?" but starting to look out and see others and go, "Oh, well, I wonder what am I missing that is in the lives of those whom I'm serving." You said that people find meaning through connections, and so when you're dealing with large, complex systems, what does it look like when spiritual care is to an organization rather than just thinking about the individual patient?
Right. So again, like, how do you think about systems and how systems behave and operate and that type of thing? But at the end of the day, no matter how large your system is, it is made up of individuals and teams. And so you can break it down to, again, individuals or small groups of people. And I think, much like being a chaplain at the bedside, one of the best skills that you can bring, kind of when the organization is your patient, is a non-anxious presence. Like, there is so much anxiety in organizations. Again, it's, held by people individually, but then you sort of put everybody together and you look at it as a system, and collectively there's a lot of anxiety. And so what does it mean that I show up as a ministry leader, and I work to be the least anxious person in the room, right? And to bring that sense of like, all will be well. and all manner of things shall be well. And so thinking of Julian of Norwich. So I think that's a part of it. But then I also think um, one of the gifts of formation, but again, to frame it as like spiritual care for an organization, how to create spaces where people have time to listen to both themselves and to each other. Because our attention is pulled in so many directions, and really our attention is at a premium. So to create experiences, spaces, reflections, retreats, call it what you will, where people are asked and invited to slow down and to truly listen to themselves and then listen to others around them. That's such a gift. And again, that's something that we do at the bedside all the time is we do that really deep reflective listening with our patients and then to mirror it back to say, "Oh, I hear you saying." And sometimes again, our patients are like, "Oh, I didn't even realize," or like, "I didn't know that I even fully thought that until I was listened to in this way." And so I think it's the same for individuals, teams, but even systems, um, to say, "Hey, our mission statement says this, but our behaviors are in this other direction. Um, Maybe this is a chance for us to reflect, to listen to ourselves. Is that really what we're intending?" Um, and so it's funny because it really is so many of these bedside experiences and skills, but then just sort of done at scale in many ways.
I want to go back to something you talked about a little bit earlier, Alyssa. You were talking about how formation is helping leaders in healthcare in your system understand the value of spiritual care and how vulnerable we are sometimes to cuts when people just look at a spreadsheet and don't really understand what we do. And I'm thinking about how whether we are providing bedside care in healthcare or whatever that looks like in other contexts, or whether we are in non-traditional roles, we're often doing the kind of work that's not revenue making, that's not driving numbers on a scale. So I'm curious about how you've been able to show the impact of ministry formation in this new role, as well as spiritual care, and just wondering if there's a similar way that chaplains can tell the story of their work or just look to the value of what we do.
I will freely admit, for all my many gifts, um, telling stories with metrics and impact is continuing to be a growing edge for me. And so I'm really fortunate that I have great colleagues and partners in that way. But I will say some of the things that I've learned are again, lean into your translation skills. And by that, I mean, what is it that the organization most cares about? Right. And so some of that is rightfully so, is revenue to be able to keep the doors open, to be able to provide these services, right? Even in a nonprofit, you still have to make money to continue to operate. Okay, so there's finance, but also that can be seen through retention, right? If you're not having to continually recruit new nurses and train and onboard new nurses, if your nurse retention is somehow um, can be shown to be improved by an orientation or by having a dedicated chaplain to a particular unit or different ways. Now, again, that's where partnering with someone from human resources or possibly finance could be really helpful to pull from their expertise to say, okay, how would we measure this? Or what are the metrics that you're looking at for retention or how much it costs to recruit new nurses? And then if we can demonstrate this is how much was saved because of these interventions, right? We think about obviously studies that have been done within spiritual care about having a chaplain in intensive care units and the advanced care planning that happens, the end of life conversations, and how that ends up leading to decreased lengths of stay. And folks either transitioning to hospice care or to a different level of care, um, perhaps sooner or earlier because a chaplain provided that intervention. So it is tricky because sometimes you have to demonstrate our work by what didn't happen. Like we didn't have nurse turnover. Um, but here's what that looks like. And so in formation, it's the same. We definitely look at retention. We look at associate engagement. So from both those who go through some of our formation programs and also depending on where they are in the organization, we look at how does this influence the engagement of those they lead? Can we see a direct impact in their direct reports because their leader has been through this formative experience? So I think there's always ways to lean into those translation skills with our partners. And again, chaplains are also natural qualitative researchers. So even getting quotes from people about the impact, um, that goes a long ways in being able to, put that with your metrics as well. Um, but to be able to say, yeah, I had reduced stress, or I approached my work differently, or I was able to resolve a conflict and it didn't escalate to having to go to associate relations or putting someone on a performance improvement plan. Like those are real metrics and real measurements that we can look at to see impact of formation, or in instances, spiritual care.
Well, that's fascinating too. One of the things that we've been working at my hospital on doing is how do we ensure that we are having our story told, not just by the chaplaincy leadership, but how do we make sure that it's being told by the interdisciplinary team and that it gets up to those people so that it's not just us saying, we're awesome. Come, you like us. Don't you really like us? It's more, how can we provide talking points to those that we're working around, not in a spirit of jingoism, but a spirit of what are we doing so that we can ensure that the team feels supported and knows that we're there for them, but also that they communicate that to the people above them, because that'll matter far more than us chaplaincy leaders talking ourselves blue in the face to the highest levels.
I was gonna say, I love what you're saying there because what you're describing is kind of in the business world. You're talking about creating raving fans, like people who are telling your story for you when you're not in the room or in spaces that you're not in. Um, and so, absolutely, to your point, to think who are the managers, the directors, vice presidents, who are the leaders who have experienced spiritual care, who have seen the impact of spiritual care, and what are two or three, if you will, talking points, catchphrases, even just a really short statistic that you can share with them that then they're going to remember and are able to share in spaces of influence as well. So I love it, like being intentional about. We know that we do good work and we impact a lot of people, but how do we equip those leaders who have found value in our work to then go on and tell the story as well?
Well, I'm thinking about our audience right now, because earlier you mentioned, Alyssa, how you there was a time when it came a time in your career that you felt like you were being called to something different. And I'm thinking about people who may be listening, who may be feeling that itch or that call, and they may be thinking, gosh, this ministry formation sounds great, or maybe not quite what I'm looking for. I don't know, but they are maybe thinking, I don't know how to get there. I don't know what that can be. So I'm wondering if we can explore what are some non-traditional or new pathways for chaplains that you've seen or you've encountered, or maybe that are still unexplored in healthcare and beyond. Do you have any ideas?
Absolutely. I do. I've got several like categories of things and then also to break it down kind of at the end into some really practical next steps as well. Um, so you prepped me well, and I appreciate that. So thinking about chaplaincy and kind of what are some natural corollaries or sort of really easy pivots, right? So of course, some of these things do require a bit of additional education, but uh, from chaplaincy, kind of a natural fit to go into becoming a therapist or a counselor, right? So MSW or LPC. Um, but also, we're seeing the rise of coaches and coaches who specialize in a lot of different areas. And so, obviously, you have both spiritual directors, and that's kind of a more um, recognized particular type of, I say coaching, but really like listening, attending, accompanying. But then we have coaches like we're seeing things like death doulas or bereavement coaches or um, life coaches or people who want to work on transitions themselves, in identity and life. So that's a very natural kind of fit. Um, then I was thinking, Alicia, thinking of your work too, like there's also kind of that end of life care specialty as well. So anything from advanced care planning, again, bereavement work or bereavement coordinator, organ procurement, um, working with sort of emergency response or crisis type things. Like, that's a pretty natural fit. You have the education path, so certainly becoming a CPE educator, um, supervisor. We're going to need more and more professors in these seminary programs who have actual experience as chaplains and are board certified. Like, even if that's not something that you do full time right away, with your credentials, your education, your board certification, there's a very good chance you could at least adjunct for a seminary or for a graduate program. And that's a great way to kind of test out if that's something you might be interested in pursuing. Or again, if you're interested in more education, becoming a healthcare ethicist. Like we already do a lot of ethics work. We're kind of adjacent to that. So if we want to specialize in that way, um, another space again I think is super exciting for chaplains is seeing chaplains move into research. And what I would encourage is, yes, absolutely, we need chaplain researchers, people who are telling our stories, but even just more broadly, because research really shows up in what we call consumer experience or patient experience. And so, sort of thinking holistically about what is the experience of a patient coming in our doors or interacting with our organization. What's our associates experience from the day that they first find out about our company to when they apply to when they walk through the doors for orientation. And so again, those are very natural sort of corollaries, I think. A friend of mine did that. She went from being a board certified chaplain, it still is, but went from being at the bedside to being a patient experience leader in her hospital. And so that's a really great space as well. I'm also thinking of a colleague that I met recently who is a board certified chaplain and transitioned into a role where she is a human trafficking advocate. So she does work both in hospital settings and in outpatient settings, working with patients and clients. Um, to help them kind of determine their own futures and path and um seek the care that they need. And so like that was something I'd never really thought of, and she was demonstrating a really beautiful pivot. um And then I think too, again, chaplains were really, really good at the listening, attending, translating, and that so often really fits into conflict mediation and resolution or de-escalation in crises, right? So again, some of these things might require some additional training, but we already have kind of the core disposition and core skills to be able to help us in those transitions. Um, and then I think the one other thing I really want to highlight too is a shift that I'm seeing kind of broadly, and I think there's even room for more of it, and that is chaplains as story holders. Like we receive everyone's stories, and chaplains as storytellers. I think there's a lot of space for more writing, creative nonfiction, books, articles, um, obviously documentaries, but other creative pieces of work. Goodness, like I love this podcast. Let's have some more. We can have some more chaplain podcasts.
Well, it's funny you mentioned that because, yeah, I think Alicia and I were talking about how much we want a good chaplain presence, especially, hey, Scrubs, come on, let's see a chaplain on Scrubs, a good chaplain, because so far you haven't seen very many chaplains. Like there was one in ER years ago. Honestly, like being able to see not just that, but being able to tell the story of what the to quote young Frankenstein, what is it that we actually do? And what is our story? And what do you and just going back, what do you mean by store holders? Because that was interesting. That is just an interesting phrase.
So I think for me as a chaplain, I always thought about I'm being asked to receive these stories and hold these stories with the person that I'm listening to. And that doesn't mean that they're mine to hold forever, because I walk with them for a season. But I also think there is a really beautiful way in which story holding can be transformed, alchemized to storytelling. And again, in ethical ways, in inappropriate ways. But there are ways of telling these human stories that let people know you're not alone. Or if you've ever wandered around, hey, what's the meaning of life? Or what's the purpose of this? Um, and so I think there's a lot of room to do that. We see, a lot of physicians or clinicians who take up writing or poetry, other forms of creative expression. Like let's have a whole chaplains guild going for people who want to be storytellers in some form.
I love that. I was hoping you were going to go in that direction too, because I find that really exciting. Okay, so for somebody listening, you said you might have some next steps. So what are some, if they're feeling stuck or they want to explore a different path, what are some things they can do?
Absolutely. So first thing is, of course, true to form as a chaplain, like a little bit of that internal work. And so, do you have a journaling practice? That's great. Or a book that I really like. There's a reason why there's like 19 or 20 editions of it, which is What Color Is Your Parachute? But in the center of that book really is several reflective writing exercises that kind of get to why why are you interested in this type of work, or what kinds of experiences have you found to be most meaningful? Who are the people you want to work alongside? Like it just asks a number of questions to kind of get you thinking in some new ways and not just immediately rushing to a solution of like, oh, okay, it has to be this thing, but thinking a little bit more expansively. Um, then the second thing would be um, obviously use your LinkedIn. So if you don't have a LinkedIn profile, super easy to set up and use. If you do use it and you've been super active, that's great. That can be another way to look for people in different fields. Um, so if you're like, well, I'm really curious about a CPE educator, but I don't know anyone in my particular area, see who you can find through LinkedIn. And I will admit, I've been really fortunate in the times that I've reached out to people to say, I just have a brief conversation, or here's what I'm considering doing for a transition. Would you have 20 minutes of time? People have been so generous to talk with me. Um, and so I do think overall I find LinkedIn to be a pretty generous community. But like, and then also using LinkedIn to watch for different job postings just strictly off of titles, like, because you might have an idea in mind, but like what it's called in different systems, you can watch for that. You can watch for job descriptions and I say, okay, this is the kind of thing I'm looking for, or here are the qualifications I would need. So I think I kept a document that was like 20 pages long of just different job descriptions, different job titles. And I'm like, okay, this is kind of getting at what I'm describing, and here's what it's called in different organizations. Um, so those are a couple really, really practical things. And um, again, I do think reaching out to people with those sort of informational interviews, especially if you're in a smaller work setting where, maybe you'd love to talk to someone at your hospital and you have a good relationship with them, but then that might set off some anxiety about, "Oh, are you trying to leave or are you looking at other things?" Um, so that's where LinkedIn can be really helpful to give you access to the wider community, um, and to ask your questions and explore some different pathways.
Those are great suggestions. And I actually have never read The Color of Your Parachute, so I'm adding that to my list. But I can add a testimonial about the LinkedIn because that's exactly what I did with my job. But the job was already posted, so this was in 2016, so 10 years ago. My organization had created this whole new role in advanced care planning, and I did not know one single person who did anything like that or had the same title. So went on LinkedIn and I found somebody in another state who had that position or something similar to it. Messaged her, just like you said, she was so generous and nice. Actually, a couple of people that I found had conversations with them, got to understand the role better, applied for the role, got the role. And what's really neat, John, coming full circle now, one of those people that I talked to on LinkedIn did not know her at all. Um, she is now working at Wellstar, and we reconnected, and we do like a like bi-monthly networking sessions together. Now, like, so it's really cool. But yeah, she was one of the first people that I ever found that were in this kind of work.
Oh, that's fantastic.
What a small world. And I will add, I totally used LinkedIn back in 2019, 2020. Um, and again, I mentioned I had an informational interview with the vice president of ministry formation in Ascension. And that was the conversation that made me think, yep, this is the next thing for me. Um, and so, yeah, just growing and expanding your network and getting to understand more about the particular role you're interested in or a pivot, I think can be really helpful.
We didn't intend for this to be a LinkedIn advertisement, but if they would like to sponsor this episode, yeah, just get in touch with us.
We do post quite often on LinkedIn if anybody wants to like, subscribe, and follow us on LinkedIn as well. And I believe you're on there as well, Alyssa. I love how this discussion is not just about so many times we can get placed into, oh, I'm this, I'm in this role. It's like the old Willie Lomax tragedy of Death of a Salesman, where we sometimes think, well, because I did this, I have to do this, and perhaps we could find an area of our lives and an area of our ministry that would actually fit us better. Um, so I love hearing a lot of your story and the transformation that's happened. So how has this shift uh, changed your own religion, spirituality, and your sense of calling? And going with that, what practices keep you grounded now that you're no longer doing direct patient care every day?
So I think part of my particular spiritual journey and spiritual practice has been, believe it or not, like trying to learn healthy detachment and letting go and kind of trusting the process. I know that that may sound a bit cliche, but I'm an Enneagram type 1, so I'm like, "Hey, we gotta do this the right way, the perfect way. We gotta do this quickly and efficiently and, not make any mistakes." And so for me, it's kind of a space of, can I learn to trust the process when I don't know what the outcome will be? Um, can I trust that even in the midst of uncertainty or, a little bit of discomfort, um, I'm still being led to where I need to be. And so that's hard work, like to do that inner work. But sometimes it's as simple as a breath prayer or a mantra. Like you can't see it, but right over my shoulder, I have um, a beautiful kind of depiction, modern iconography of um, Hildegard of von Bingen, and her phrase was, "I am a feather on the breath of God." And so just thinking like, okay, can I trust myself that I'll go where I need to go? I'm gonna evolve and grow to become the person I need to be. That I'm being led in that. So those are some of the like spiritual practices to just truly trust, even if I don't have it all mapped out. I'm gonna find where I need to be and who I'm called to serve. So those are some of those practices. And then I will say too, one of the things that happened for me during COVID, I remember just feeling so much information overload. And many of my spiritual practices were around reading, writing, all very like words based. And I found like I don't want that. I don't want any more of that. I'm so overwhelmed. And so I actually took up um, watercolor during that time, and not even necessarily landscapes. Like you're never going to see my paintings on Etsy. Like I cannot monetize that in any way, shape, or form. Um, but just even the practice of paying attention to how much water you put on your brush and what happens, or what happens if you blend these colors in this way, or um, what if you take a straw and like blow the paint and move it around the paper, right? Um, there's something about moving from words, whether it's as a chaplain that you're hearing and listening and receiving, or my work now, like facilitating and speaking and writing as well, to now my only thing is to be present to color, texture, shape, um, and how that all sort of intermixes and interplays. And so that's been a really life-giving spiritual practice, and um, actually something I get to do later this month, to go on a watercolor retreat. So I'm pretty excited about that. Yeah.
I love that because another thing I love about that is that it's a concrete thing that you can finish and hold, because so much of our work is so abstract. So that's beautiful. Yeah, and you can hold it and behold it. So before we finish, I I would like to. That sounds very hope filling as I hear you talk about being a feather. Knowing that we can transform and evolve. That sounds so hopeful. But I'm curious if there's something else or something specific that you feel hopeful about in chaplaincy itself as a profession, when you look at where we've come or how far we've come and what may be possible in the future.
I really do feel incredibly hopeful about chaplains telling our own stories. And I remember thinking this during COVID, when there was a piece in the Atlantic written by a chaplain, or stories where, chaplains were speaking and sharing their experiences being picked up by mainstream media. Um, and I remember thinking, wow, I don't remember seeing such a high volume of chaplains coming forward to tell our stories and to be able to explain the work that we do and why it's significant, why it's important. So I'm really hopeful. Like, are we going to tell our stories through metrics? Yes. Are we going to tell our stories through research? Yes. Are we also going to tell it in really creative ways and forms? Writing and poetry and music and dance and theater. I mean, who knows? Like, yes. And I'm really excited about that because I think people will get to experience what chaplaincy is all about and what it means to be a chaplain.
I love that so much. That makes me feel so excited hearing you say that.
I'm excited. I'm like, I am so grateful for the work that the two of you are doing. And um, like I said, I mean, and again, having a social media presence, LinkedIn, putting this on YouTube, like again, these are ways of telling the stories, and I'm so grateful because in doing that, you help evolve the discipline as well.
One of the things that I just attended was a webinar that was put on by three people who were uh, very involved in like putting up informational and uh, also educational pieces that are meant for online engagement. One of them is Pastor Paul Dries and the Reverend Jerlyn Henry, and then Alexis Rice. And it's with a group called the Sacred Slope. And they're not monitored, by the way, they did not sponsor this, but they put together this very interesting, very beginning piece about how do we get our messages out there so that when people are dealing with when we're dealing with the garbage that happens in our lives, and it might be a midnight doom scroll, how do you how are we going to meet them so that they receive a message of hope, of life, of transformation? And so that for me that was nice because it wasn't the traditional thing that we always think of as, well, this is traditional chaplaincy. It's a ministry where people could be met in the dark nights of the soul, if anything.
I love that. Replace doom scrolling with, I don't know, hope scrolling or you're just even knowing you're not alone, like you're seen even in that moment. Um, I love that. What an important work.
Hope scrolling. That's perfect. Speaking of hope, we always finish with a question about what's giving you life these days. I know you've talked about your watercolor retreat coming up. Is there anything else that's filling your cup?
Watercolor retreat and God willing, a trip to Europe later this summer. Um, I always find, again, travel is one of the best ways to learn, to listen to people, and pick up new things that I wouldn't have known otherwise. So I'm kind of with anticipation looking forward to that and all that I will sort of take in and the stories I'll hold, the stories I'll tell after that experience.
Have a great trip. That sounds lovely. Thanks for being here. It's been such a good conversation. And I know that a lot of people, it will resonate with a lot of people. So we appreciate you.
Thank you so much.
And now it's time for the non anxious presence with Alyssa.
And John. So this has been a delightful conversation. Like one of the phrases that just stick out in my mind, of course, is like uh, hope scrolling. The idea that we're going to be, how do we get our stories out there as chaplains in the outside of the box, the non-traditional ways that people consider the actual chaplaincy.
I know, and I love this imagery that she gave us of, evolving and transforming. It actually went back to my spiritual formation. One of my spiritual formation professors in seminary, um, the way that he talked about faith formation. And I remember he said something like, um, when a seed grows, it doesn't just become a bigger seed. It transforms. It transforms into a full mature tree, with branches and all this. So your faith growing is not going more of the same. You don't stack more things on top of each other. There's transformation involved. So I love applying that imagery to our vocation as well. That's part of our identity. Of course, it's going to change. And if you've been a chaplain for a while, I mean, there are chaplains, friends of mine who have been chaplains for 30 years and they still love what they do and they want to keep on doing exactly what they're doing. But then there are others and it's not like that doesn't change. I know it can evolve even in the same role that you have and the relationships evolve. Um, but there are times perhaps where your vocational identity does change or the roles that you find. Maybe you are not even looking for something different, but something crosses your path and you pivot. So I love that image.
She gave some good concrete examples of what people can do, whether that's through just, I love the having a professional interview. Just that phrase really stuck in my mind. Going and meeting with key persons to be like, "Yeah, this is what I'm looking at doing. What's your advice?" And also uh, meeting with partners across the institutions where we serve. Like, what are some of the key metrics that we can use with finance, HR, nursing, uh, attendings? How can we make it so that we partner with them so that we're not just, well, part of it is they can see our story, but part of it is also that we are able to grow and tell our story so that we're not just spinning our wheels.
Yeah, that's what makes me the most hopeful about with what Alyssa said, but also chaplaincy as a whole is our role in storytelling. I have tickets in May to watch a new documentary called The Chaplain and the Doctor that's doing a national screening. I just love how there's more of that right now. I know the APC conference is also screening a movie about Muslim chaplains. Last year, it was chaplains in the military. I think there was a movie about that. So there's more. She's right. Like there's more articles, books been written about what chaplains, but also by chaplains. We talked with somebody recently who writes fiction books. So yes, that's all really great. Just thinking creatively about how we tell stories, but also we're educators normally. Chaplains, we're always educating, and there's so many different ways of doing that.
That was a fantastic discussion, and I'm feeling there's a lot of hope that comes from these discussions. So yeah, thanks for joining us.
The other image that, if I can just like point it out, that came to mind when Alyssa was talking about it, and I guess it's because we're recording this on the eve of the Kentucky Derby, but but it reminded me when I was doing my CPE training that one of the staff chaplains at the hospital, who was like giving us a workshop, he said that chaplains are a lot like thoroughbred horses, that we're always pivoting, because like one minute you are caring for somebody in a very difficult time, maybe they're at the end of life or bereavement. The next moment it's a crisis situation where things are moving very fast. The next moment you're with a newborn baby that you're blessing or doing a ritual. There's just so much that we're always pivoting already. So we have this wonderful blessing that Alyssa actually shared with us from Jen Richardson that we will end with, that talks about being in those moments. So Jen writes, with every step you take, this blessing rises up to meet you. It has been waiting long ages for you. Look close and you can see the layers of it, how it has been fashioned by those who walked this road before you, how it has been created of nothing but their determination and their dreaming. How it has taken its form from an ancient hope that drew them forward and made a way for them when no way could be seen. Look closer, and you will see this blessing is not finished, that you are part of the path that it is preparing, that you are how this blessing means to be a voice within the wilderness and a welcome for the way. Jen Richardson, I think it's from A Circle of Grace or something like that. And we hope that you carry that hope with you and that you have a great rest of the day. Thanks for joining.